There are still a lot of questions about the coronavirus, and we are here to help you get some answers.
Wood TV 8 and our community partner, Metro Health, are addressing your biggest concerns. And Michelle DeSelms is here now with what you need to know.
Yeah,
Michelle.
The emails really have been pouring into us, so we know there are still a lot of questions about this virus, and there is also a lot of misinformation going around. That's why we are turning to the experts for help. Lori Price is the Chief Operating Officer of Metro Health. Thanks for being with us tonight. And first off, how are things going there? You know, we've heard a lot about short of supplies and beds. How's it going at Metro?
Things are going well. We have our incident command open, and we're managing through this challenging time as well as we can at this moment.
All right, that's good to hear. All right, so let's get to some of our questions now from the viewers. This is from Mary, who is over 65, diabetic, and wants to know if it's safe to visit the chiropractor, dentist, hairdresser, or even the doctor for a routine visit.
Sure. We all need to be practicing social distancing right now as much as possible, especially if you have any reason yourself to believe that you are at a higher risk for a severe infection, such as if you're immunocompromised or something like that.
Sure, we know a lot of those places, though, have closed down for the time being. Okay, we've had a lot of questions about what to do if you have mild symptoms. John Harrington says he has a sore throat, cough, stuffed up, no fever or aches, though. Is this something to be checked or wait to see if fever breaks out?
Right. So if you're able to manage your symptoms at home, you should stay home and get well. If you feel like you're too sick to manage your symptoms at home, we want you to first call your primary care provider. Don't go directly to the office. Call first, and so that they can help manage you if you need to come into that office. But as always, call 911 if you feel like you can't breathe or if you're having any other further difficulty.
All right, Erin Dilley is asking, how many days does the coronavirus typically last once you have it?
You know, that's a tough question right now. So in healthy adults, the coronavirus is very similar to a cold. But what we have seen in the reports that we're reading too are that it can be as brief and mild, or it can be long and severe. So that's a little difficult to answer at this time.
Yeah, kind of a wide range there. Okay, Joanne Walker is asking about her pet. Can a dog get coronavirus and then give it to our children?
Right. So according to the CDC, right, animals can carry viruses that make us sick. But at this time, especially in companion animals, we haven't seen that spread. But at the end of the day, if you are sick, you should distance yourself from your animals.
Okay, great. All right, Desandria Griffin wants to know if infants have a higher chance of getting the virus.
Infants have underdeveloped immune systems, just like our older adult population too. But there is little information about the coronavirus for infants. However, you should always be careful around the very young and the very old.
Right, sure. Any time of year with any sickness, really. Yeah. Okay, with restaurants closed to indoor seating, Cheryl Gunn wants to know, is it safe to be handed food from a drive-thru? Can the virus be on our drink cups or bags that the food comes in?
Right. So the virus can live on surfaces up to 9 days. And the most important thing that you can do at this time is to, when you're out in the general public, is to wash your hands and keep your hands off your face. So washing your hands is the best prevention.
Okay, great. Thanks. All right, finally, Rene Davis wants to know if an employee is staying home because they're sick, how do we determine when or if they should return to work?
So right now, once they are symptom-free for 24 hours, but of course, you know, this information changes frequently, but right now that's what we're saying, 24 hours symptom-free.
24-hour symptom-free. Okay, well, Lori Price with Metro Health, thanks so much for being with us tonight. Really appreciate it. And of course, thanks for all you do and all your staff at Metro.
Thank you.
All right, and keep submitting your questions to us. You can email us at community@woodtv.com, or you can post right there on the Wood TV Facebook page. The experts from Metro Hospital will join us live every day at 5:30 to answer your questions.